debate about it. Previously, people said that it is because they have a better reporting system, they report more, they are more aware, and the northern states do not report the suicide. So probably that is what was causing the discrepancy. Unfortunately, after repeated studies of researchers, it is clear that despite all the differences that were expected, there is actual difference in suicide rates between the southern states and the northern states. I mean, they actually have a higher rate of suicide. So this is one important, another very important, and I would rather say an intriguing finding in the country. Now, just a brief look at the scenario in Sikkim. So it is the state with the highest rate of suicide in India. So the national average is 12.4 per lakh population. Here it's 43.1 per lakh population. So that means more than 3 times the national average, 3.5 times the national average. The remaining years also the rates were equally high, 42.5 and 39.2. And in the last 10 years, the curve shows that the rate has been gradually increasing. The trend has not been downward, it has been gradually increasing only. And rates as in the remaining part of the country, 50 to 24 year age group, that the young productive age group, the ones which we do not want to lose, are unfortunately falling victims to the acts of suicide. Hanging is the commonest method, followed by jumping, as you can expect from a city which is having such a high altitude. So jumping is another method. Higher rates in those with lower education and socioeconomic status. This is one or two researches, not very strong findings. It is happening across all socioeconomic strata, but this is one study I have found which have identified lower socioeconomic strata. So now comes the question, whose responsibility is it? Is it the doctors? Is it the societies? Is it the NGOs? Is it the governments? So probably it is everybody's business. So no one can actually shirk the responsibility and say that no, it's not my business. See, suicide is probably one of the very few areas of psychiatry which you can say has public health importance. So being a mental health professional, I cannot say that suicide is my domain. It's a public health problem. So it involves the entire society, the entire state, all the strata of the society, all the functionaries, all the stakeholders of the society. They should all work together to prevent this menace. Government, healthcare professionals, NGOs, very, very important. They have a reach in areas where many government arms cannot reach. Individuals, obviously, and media. I think these all major stakeholders should play their part in reducing the menace of suicide and suicidal deaths. This is just a brief outline of the WHO method of prevention. One is universal prevention strategies, which is acceptable or directed to all the individuals. It's global strategies. Then there are selective prevention strategies, where you select a particular group who are more vulnerable, and then you do, for example, a particular age group, a particular sex, occupational status, those groups. And finally, indicated prevention strategies. This is targeting the individuals who have so-called survived an attempt to suicide. So these are the 3 levels at which we can attempt to prevent further acts of suicide. So common public awareness programs, the ones that we often do, involving all the common laymen, common people of the society. Part of it we are doing here. So how to recognize the risks of suicide? What are the risk factors for suicidal behavior? What is the role of the underlying mental illness? Whether there is stigma associated with suicide and how to reduce it? And and the direct role in reducing rates of suicide not found. So definitely, if you are increasing the awareness, it reduces the stigma and it improves the attitude of the public. So if I am conducting multiple awareness campaigns, what happens is some of the people who are influenced by the campaigns are likely to influence their neighbors, and at least many of the people who would not otherwise gain access to the proper hospital or the proper professional are usually taken to those professionals. So some indirect role of awareness campaign is there. Restriction of access to means, this has been found to be very helpful in areas where pesticide poisoning is important. Many of the areas of farming areas of Gujarat, Tamil Nadu, Maharashtra, there is one area of Maharashtra which is extremely notorious for farmer suicides. So the government has made several attempts, for example, to reduce the accessibility of pesticides. So suddenly if I have an argument with my family member, I will not be able to access the pesticide at home. So pesticides are usually kept in a centralized locker. They are to be taken out only at the time of farming and again put back at the centralized locker. So these kinds of system, then replacing more fatal pesticides with less fatal pesticides. So these are some of the changes that have been carried out. This policy has been found to be very effective in certain other countries. I can talk about our neighbor Sri Lanka, where the suicide rates were very high, and pesticide control has proven to be a very effective method to reduce the rate of suicide. Here probably in Sikkim it would not matter much, but it is generally restriction of access to means is one of the major proven methods of reducing suicide. Legal issues, I think this is very important. Previously, the infamous section 309 of IPC, infamous means for us, those who work in the areas of suicide. Actually, it was previously thought that if suicide is punishable, as per this act, any person who attempts suicide and subsequently is rescued may face an imprisonment up to 1 year. So this act was brought primarily, or it was brought in primarily because people thought that this will be a deterrent to suicide. So a person who plans to attempt suicide would probably fear arrest and would not do so. In reality, what research has shown worldwide is that it does not prove as a deterrent to suicide, but actually it is a deterrent to suicide reporting. See, what happens is when a person is in serious mental distress or impulsively trying to self-harm, the person hardly thinks what will legally happen to him or her when he or she survives, because the person is genuinely willing to die at that point of time. So litigation is not something which can act as a deterrent. On the contrary, after surviving a suicide attempt, a person immediately needs a proper medical and psychiatric care, because that will prevent or reduce the chances of a future attempt. Immediately after an attempt, for the next 1 month, it is a very vulnerable period when the person may attempt another suicide. So if there is a law which prevents, which talks about arrest, then the guardians and the family members and the subject himself will be very reluctant to report it. So that will also have an indirect consequence of not going to a mental health professional, and that can again lead to another act of suicide. So this was much talked about. Subsequently came Mental Health Care Act of 2017, and there's a section 115 of Mental Health Care Act which clearly states that when a person attempts suicide, it will be taken as occurring due to a mental illness unless proved otherwise, and it is the responsibility of the state to take care or ensure that the person gets proper medical care and attention. So this has been a major step forward. Although section 309 has not been annulled or removed completely, but it has definitely lost its teeth. So probably this is one good step in the direction, and it actually has increased more awareness, and it has encouraged people to, or family members, from reporting to report acts of suicide. Training of primary care physicians. Here we are conducting a awareness drive kind of a thing, where many of you who are not directly dealing with patients or subjects with suicide are at least getting some idea about what a suicide is all about, what kinds of warning signs should be there to identify those with potential acts of suicide. But training of primary care physicians, basic physicians, is very, very important. Worldwide it has been found that more than 60 to 70% of the people who attempt a suicide have at least talked about it directly or indirectly to their primary care physician, not a psychiatrist, but a family doctor. At least they have tried to drop a hint within the last 1 month of a suicide attempt. So if a primary care physician is strongly made or strongly sounded the necessity to not to downplay any hint at loss of life or suicide on the part of the patient, then it can lead to lot of suicides being prevented. Usually what happens is people drop a hint, the primary care physician or the family physician do not have a high index of suspicion. They usually reassure the person nothing will happen, but ultimately the suicide happens. So training of primary care physicians, making them very strongly aware not to ignore acts, or because there is a general myth that one who talks about suicide will not commit an act of suicide. So this is a very important myth that needs to be dispelled. So anyone who talks about suicide should be taken extremely seriously. So whenever in doubt, you should always give benefit of doubt to the person who talks about suicide. And this awareness among the general care physicians is very, very important. Gatekeeper training, something like which we all can do across all institutions, academies, villages, hostels. So any small community which has 1 or 2 community leaders. So it's, for example, in an IIT, in a management institute, there would be a hostel, there would be a hostel prefect, there would be a hostel superintendent. So the person who is in charge of a facility, if he or she is made, he is considered as a gatekeeper. Similarly, a village member of the village panchayat. So these so-called gatekeepers, if they are taught the basic ideas, the basic signs and symptoms of suicide, in the sense that when these signs and symptoms are identified in an individual, you should talk to the individual properly, and if necessary, encourage the individual or the family to take proper professional care. So this is what we know as gatekeeper training. The basic idea is that a person is likely to divulge his or her private thoughts more to a gatekeeper than to a professional like a psychiatrist or any other doctor. So if you train the gatekeepers, chances of detecting a person who is planning to take away his or her life is much more. So this is a very important part of suicide prevention strategy. And gatekeeper training should be organized at all levels in the state and the country, and it have actually been found to be very helpful. In fact, it has been carried out in our institute. We have carried out gatekeeper training with the military, the paramilitary forces, mostly BSF, CISF, and actually they have said that the greater awareness has proved to be beneficial in dealing with many potentially suicidal individuals in the forces, because again suicide in the forces has currently become one of the major areas of concern. Now, psychiatrists, obviously we have a role. As I have said that at least 50 to 60% of the suicidal individuals have a diagnosable mental illness which is often missed because media report usually talks about exam failures and other immediate stressors, but actually many of the times it is the mental illness, untreated mental illness or inadequately treated mental illness which is a culprit. So psychiatrists and mental health professionals, including psychologists, psychiatric social workers, they all have a role. They all have a role in treating the patient adequately with proper medicines, with proper counseling, and it definitely will help in reducing mental illness and consequently reducing the rates of suicide also. Postvention is important. This is basically a support that should be offered to individuals who have lost their near and dear ones to suicide, and it has been found that many of them, especially those who were dependent on the individual who committed suicide, have a subsequent chance of committing the act. So postvention is also very, very important. Follow-up care after a suicide attempt, again this is very important. One individual who actually survives an attempt of suicide, we often label them, we often ignore them, we often shun them, but actual research has shown that if you regularly follow up, this is for mental health professionals but it applies equally to family members and neighbors. If the person is regularly kept in touch for the next 1 to 1.5 years, there is no chance of a subsequent act of suicide. So at least once a month, if you keep in touch with the individual, even a simple question like how have you been keeping, whether you are having any further distress or any further thoughts of time, some simple interaction at least once a month can go a lot in preventing further acts of suicide. This is most important. I think I cannot emphasize it enough. Last time also we have talked about it, and here also I am going to talk about it again and again, and it is the role of the media and in increasing the rate of suicide. As we all know that media has a profound influence on our lives, and in Sikkim also last time when we had come there were a few suicidal deaths, and actually we had talked about unethical reporting in the sense that when you report suicide there has to be certain sensibilities expected in the reporting, and this has been proved in the last almost 50 to 60 years across studies. Vienna deaths, metro deaths, this has happened in Kolkata also. So whenever there is a sensational act of suicide and the media reports it with lots of hype, usually it leads to increase in the acts of suicide within the next 3 to 4 weeks. And the acts of suicide which happen as a result of sensational media reporting, we call them as, mostly commonly call them as copycat suicides. Usually copycat suicides occur in a similar fashion. The similarity in the copycat suicide to the actual act of suicide can be in terms of age groups. So if it's a young male who has committed suicide, it can be young males. If it has been a method of suicide, for example, someone has hung himself and media has publicized a lot about it, there will be subsequently 3-4 cases of hanging. So these kinds of things, and very commonly, usually it is, and if the individual who has taken his or her life is a celebrity, it is bound to lead to copycat suicides. So what exactly is wrong with such acts? So the basic idea is that when you are reporting an act of suicide and when you are sensationalizing it, it actually influences a significant proportion of people who probably were suicidal or who probably were going through depression. And such acts of suicide suddenly tilt their decision in favor of committing an act of suicide. As we say that a person who plans to die often goes through a phase of ambivalence or weighing the pros and cons. They think I may take my life because life there is so much of suffering, and then they say no, I have my child, I have a mate at home, I have my ailing mother. So there is always a weighing of the options. One mind says that you commit the act and get relief from all your sufferings. The other mind says no, there are so many consequences of your death, so you should not take away your life. So when a person is in this kind of an ambivalent state or in this kinds of a confusion, a sudden reporting and sensationalizing act of suicide in the media actually tilts the decision of many of such individuals. So the bottom line is a sensational reporting of suicide can lead to certain suicidal deaths in the immediate phase of reporting and the next 2 to 3 weeks. So this has to be prevented. Media guidelines have often talked about such preventing such reporting. So what should be done? So this is what is written, as you can see. Avoid language which sensationalizes or normalizes suicide. Avoid prominent placement and undue repetition of stories of suicide. An act of suicide should never be in the first page and should never grab the headlines very prominently. This is very important. Avoid explicit description of the method. Do not describe explicitly the method that has been used. Avoid providing detailed information about the site of a completed or attempted suicide. I still recall that there was a high-rise suicide in Calcutta that had happened some 6-7 years back, and the place was explicitly described, and the event, how they went to the terrace and they committed the act. Actually, after that particular terrace of that particular tower of the building was chosen by 2 further individuals to commit acts of suicide within 1 month. So explicit and detailed description of the site and also the method of suicide are a very strict no-no. Headlines are to be worded very carefully. Failure of exam takes lives. If such headlines happen, it is bound to lead to similar acts following failures in exams. So suicide is a multi-phasic, multi-cause phenomena. There is no single cause for an act of suicide. There can be a sudden trigger. So a trigger should not be oversimplified as the cause of suicide, and that can lead to a lot of disasters. Exercise caution in using photographs or video footage. You will see blatant violation of all these things when you look up newspaper report, especially in the social media. I'll come to that. Provide information about, show due consideration for people bereaved by suicide. The report should provide information about where to seek help. This is very important. As I was discussing the last time, there are certain newspapers which actually provide a helpline in which they write the name of a suicide helpline below every suicide report. The Hindu practices it explicitly. So I think this is one good practice, because the moment one feels affected by reading the news of suicide, he can immediately look at the helpline and start seeking help. Avoid hyperlinking of suicidal material on social media and provision of a help center with FAQs on suicide. So these are some of the things that can be done. This is mostly about print media. In fact, if you look at what the government has done, look at the last line, Press Council of India adopted guidelines on suicide reporting in newspapers in September 2019. And in the guidelines, they have written and mentioned all these points that I was discussing. Unfortunately, Press Council of India, being a quasi-judicial body, all the newspapers do not have a legal binding to follow them. So the guidelines still remain unimplemented to a very large extent. Social media. Now, when we discuss about print media, there are ways to regulate because you know whom to catch, how to find out the source, and you can actually take legal action, punitive action. You can at least call the editor and tell that you should not follow this. However, social media has opened the Pandora's box. You do not know where from the message originated, whether there is a fake account, who is spreading it. See, there are so many ways, myriad ways of social media spreads a message, and today mostly people read social media and get influenced. You can see ghastly pictures of people dying, people killing each other, all this content which is actually not expected to be there or not supposed to be there. So social media has a very dubious role in suicide, but one or two things are very clear. If you are too much into social media, probably you are increasing certain risk factors related to suicide. Inadequate sleep, sometimes social media associated bullying behavior. Also, there are other things, for example, social isolation. So these are some of the indirect factors. If you are excessively using social media, they can influence your risk of committing suicide. Social media also may introduce certain novel exposures, certain new exposures. For example, social media can actually tell you certain unusual methods of committing suicide. Again, something which otherwise a normal person cannot be able to access. So social media has a potential danger of influencing negatively the rate of suicide. Plus, most of the things about newspaper reporting that we have said applies to social media, and we are practically in a very difficult position when we are planning to control the social media. There are certain guidelines which have come, again proposed guidelines for social media handlers when they forward or report an act of suicide. And I think this can largely be implemented, at least if we look at social media handles of media houses, e-versions of newspapers, e-newspapers, at least renowned YouTube channels, and we can always have an interaction with some of the known YouTube influencers. At least if this group can be kind of told some of the basic methods or basic outlines, probably it can help. So include a content notice. What they say that if you are including an act of suicide, do include a warning that the material that you are about to read has potentially unexpected content which can induce anxiety in you. So you have a choice of skipping the material. So a content notice is what has been suggested. Limit the details, just like the print media. Do not write the act of suicide, the site of suicide in details in social media messages and reporting. Be cautious with images. In fact, try not to give images of the individual affected by suicide. Images means images of the individual after the suicidal act, or images of the place, site, anything which can cause similar kinds of repetitions. Do not sensationalize or oversimplify, and provide link to websites for seeking help. So at least if these basic minimum criteria are followed by the handlers of the social media when they are forwarding or spreading a news of an act of suicide or even reporting an act of suicide, probably it can go a long way to reduce the copycat effect of media reporting. NGOs, there are NGOs here also in Sikkim who run 24-hour helpline numbers. There are NGOs who work with mental health patients, rescue them, seek their treatment. So you can never underestimate the role of NGOs. They always have a potential role, and I think role of NGOs will go on. The more you involve them, the more their reach, the better to reduce the treatment gap in this country. So what are the most effective interventions after so much of details? Physician training and education, controlling the media, restriction of the means, gatekeeper training, and suicide intervention should be multimodal. You cannot stick to one method and expect it to have results. So basically you should have a multi-pronged approach wherein you involve all these steps, and then probably it will have some perceptible change maybe in 4 to 5 years. This was national strategy. This is important because all big countries, all advanced countries did have, India did not have, a national strategy for suicide prevention which plans to reduce the rate of suicide by 10% by the year 2030. We do not have much data regarding how far it has progressed, but overall state-wise data shows that the level of implementation is much preliminary, and there's a major gap in its implementation even after 3 years of its enactment. But nonetheless, it does have some importance for all of us, and probably every state should make attempt to implement the national suicide prevention strategy to their fullest. So coming to the final concluding points, suicides are preventable. We need not be extremely nihilistic in the sense that one who decides to take away his life, we cannot do anything about it. No, the answer is definitely not there. The answer is, if we make calculated long-lasting attempts, suicides can be prevented overall. For national responses to be effective, proper implementation of national suicide prevention strategy is needed. Proven effective strategies include restriction of access to means, controlling sensationalization of media reporting, training of general medical officers, making proper implementation of section 115 of MHCA, and gatekeeper training. And finally, I must say, the next topic, as Dr. Preeti is going to highlight in detail, substance abuse, I must say that substance abuse, especially alcohol, has a strong bearing on suicide. Many a times when a person is planning to make an attempt, they do so, ultimately they make the final attempt under the influence of substance. So if you reduce alcohol and other substance abuses, there is definitely going to be a ripple effect, a favorable ripple effect in terms of reducing the rates of suicide also. I think that's all I had to say. Thank you.
Put any questions you have in front of our resource person.
My name is Rajappa. I'm from class 11 Humanities, Grindel. So I have a small question.
Yes.
Like mental health, we've talked about it. Now regarding that, so like we just had our results a few days ago, class 10.
Yes.
And like I didn't get like the expected marks, and so I went like, I didn't have any peers I could talk to, so I went to find some like places where I could talk about it, like let's say websites, free websites. I found a few of them, but like, sir, can you suggest me some things? Like the helpline there is, I've seen one helpline in Google, and I tried calling them, but like that did not work. So what do you suggest where we can get like the free course? Or because like if we take a normal course, they are charging us fees, which we as students cannot take it. And like even if we tell our parents, we know we'll get more severe problems then. So what kinds of helplines do you think we can like look?
Yes, see, there is one, the government of India, and it's available in 22 languages. It's called, the project is called Telemanas, and the number is 14414. So in fact you can just Google Telemanas also and see the number. So basically it's a toll-free 24/7 helpline, and which is available in almost all the states of the country. It's available in Sikkim also, and even if it reaches another state, it is supposed to be routed to the particular location of the individual from which he or she is calling. And here you are expected to be given a patient listening by trained counselors, and you can talk about your distress. It's free of cost and available 24/7. Nationwide.
Hello sir, my name is Preeti from Class 11 Science Grindal Senior Secondary School, and I have a question. Normally a lot of my friends, they have a lot of problems, like family problems, educational, like failing exams and all, and they come to seek help to me, and normally I just listen to them, but I struggle to give them suggestions or help them. So what do you suggest, like I could suggest help advices to them, like because most of them they fear to call national helplines and all. So what do you suggest?
Again, to this I'll suggest, please have your seat. It is good each people come to you. Maybe you are a good listener, or maybe you are an empathetic listener, and maybe you have the potential to counsel others in the long run. As of now, since you are not trained in it, you can give them a patient listening for the time being. They may not be willing to go to mental health professionals for the sake of stigma. Do offer them that alternative. In case they refuse, you can give them this helpline number, because this one of the good points about this number is it ensures complete anonymity. So rather than going to an uncharted territory or an unknown helpline where you do not know the consequences, and you don't have any they don't have any accountability, it's better to refer to them for 14416, and because it's completely anonymous and they will get advice as per their problems.
Girls from Standard 10, I would like to ask a question. Even after seeking help from psychiatrists or many other doctors and taking medicines and seeking help from all of the things, but even still you can't come out from your traumas and the suicidal tendencies, what can be done?
See, the desired result that can happen to any malady, let alone psychiatric or mental health conditions. That can happen with any kind of a physical problem. It can happen with sugar, pressure, thyroid, diabetes, anything. See, the idea is to seek help, and certain conditions do not seem to respond immediately, or maybe they take a long term time to respond. This is number one. Number two, sometimes complicated mental health situations may warrant a longer term treatment and therapy, and sometimes the therapy may not give an initially encouraging result, but the basic idea is to hold on and continue a periodic follow-up, because if you leave that, probably the situation is going to be even worsened. So my idea is to carry on with your follow-up and treatment.
Class 12 Commerce from Judicial Senior Secondary School, and I have one question. In first part you said that states which are like developed, they have more suicide rate, and which states which are underdeveloped has less suicide rate. So could it be like states like development and suicide rate are like interrelated with each other?
That's a very good question. Please have your seat. It well in terms of economic development and in education, how can suicide be more in those states? So is it as you have said, apparently it appears whether improvement in these domains will lead to increase in suicide? The answer is actually no. The basic problem is that suicide is a multifactorial phenomenon where there are 10, 15, 20 factors interplaying with each other. And it also has a biological and a genetic basis. So simply trying to pigeonhole it in terms of whether a state is developed or underdeveloped and the suicide rates accordingly, trying to relate it would be an oversimplification. The basic answer is no. That doesn't mean any state which is very well developed, that does not mean that increased development is causing more suicide. It is just a chance, it is probably a chance association.
Been in the field of psychiatry for more than a decade. Opportunity to work closely with people with addiction-related problems and ended up developing a lifelong interest in addiction medicine. She believes that all the addicts can be helped provided they are willing to continue with treatment, which lasts for more and requires regular consultations. And now request the learned resource person to kindly take over her session. Thank you, ma'am.
Thank you. And before I begin, namaste everyone. I'm really grateful to be here, and it's an honor and privilege to be here and to be able to talk to so many people. I can see there are children at the back, and it's really good to be able to interact with such a diverse audience on this topic, which is very close to my heart. So the agenda of today's discussion will start with the extent of the problem. I'll talk a bit about the problem in the country as a whole, and then I'll talk a little bit about what I've found about the statistics for Sikkim, and then we'll discuss what are the stages of substance abuse, what causes substance abuse, and since we are talking about causes, we'll also talk a bit about how can we prevent substance abuse from becoming a problem. And then we'll talk a little bit about management, and lastly we'll discuss the role of technology in management of substance abuse. Okay. So when we talk about the prevalence and patterns of substance abuse in India, alcohol, it is the most common substance which is being abused. I'm not talking about tobacco here. So in India, in the age group between 10 to 75 years, around 14.6% of the population consumes alcohol. When we talk about dependence or addiction, the numbers are 5.2%, which would be around 57 million people. See, this data is from a report that was released in 2019 by the Ministry of Social Justice and Empowerment. It was the Magnitude of Substance Abuse in India report. So alcohol would be 5.2% rate of addiction. Cannabis, around 2.8% of the population uses cannabis. 0.66% is dependent on it. They are addicted to it. Opioids, now opioids include prescription opioids also, heroin, afine, whatever. So opioids are used by 2.1% population, and 0.55% are dependent on it. So that would be around 23 million population. Inhalants is less common. You'll see it very commonly among adolescents, especially if you go to railway stations or if you are passing by roads in big cities and you see the homeless children. Many times you'll find them inhaling something in plastic packets. So they are the people who are addicted to inhalants. Cocaine, amphetamines, hallucinogens, gradually picking up, especially in bigger cities. Thankfully, still in the rural areas, these substances are not common. But in the bigger cities, even in tier 2 cities, these are gradually becoming more and more common, especially in the party scenes. When we come to Sikkim, I was actually surprised when I was looking at the data. So there's this National Family Health Survey, the government keeps repeating it. So the fifth version of the survey, the fifth NFHS 5, which was done from 2019 to 2021, it showed that Sikkimese women rank second and men third in alcohol consumption prevalence across the country. So that was really shocking for me because I had no idea of this. It also reported a decline in alcohol consumption among both women and men compared to the previous survey, the fourth round of the survey. So among women, alcohol consumption decreased from 23% to 16.2%, and among men from 51.2% to 39.8%. So should we be happy about it? Why no? Yes. Okay. There is a little catch here. See, it looks good, but some authors have said that this decline in the number is an artifact of COVID. So these were the COVID years, and probably COVID might have that lockdown and all that might have led to that artificial decrease, and the next round of the survey might not be that encouraging. So maybe we can be happy for a little time, but we should not give up working to reduce the numbers. See, the family health survey took data only on alcohol. So for other substances, we have to depend on the other report, which is magnitude of substance use in India 2019. So in that report, Sikkim was found to be among the states with the highest prevalence of opioid use, which is with more than 10% of the general population being affected. So commonly we think of states like Manipur, Mizoram, but Sikkim is also along with those states at the top, so which is a very bad statistic. Cannabis use is the most prevalent in Sikkim. Of all the states in the country, cannabis use is the most prevalent in Sikkim, where 7.3% of the population reported using cannabis. Even Nagaland, Odisha, Arunachal, Delhi, they were all less than this, less than 7%. So that is definitely an alarming statistics for us. When we talk about the stages of substance use, how does it start? So the children are there and they would be knowing it. Definitely it starts with experimental use. So maybe you have a friend who has had a peg of alcohol and he comes and tells you कि पापा की बॉटल में से कल मैंने थोड़ा सा लेके देखा, and then there's a crowd around the kid and everybody asks कैसा लगा, क्या लगा, and then ऐसा हुआ, मजा आया, everything they say, and the other children become curious, and maybe the other children are also encouraged into trying it. And sometimes there's bravado, sometimes there is the sense of boasting. When you've tried something, you like to talk about it because others haven't yet tried it, and it makes you feel a little bit special. So others are also encouraged to try. So as long as it is experimental use, what is important is that the user has full control on the behavior. As of now, in this stage, control is full. There is no difficulty in controlling the behavior. Gradually what happens is that it becomes a little bit more common. So there would be parties. So you go to a party and you would see alcohol is very common at parties. There are states in our country where having cough syrups is common in parties. So there can be no party without a crate of cough syrup, and it's given as an option to you, hey, what's your drink? So some people will go for that as a drink. So it varies with culture, but then when you start going to parties and you find it that it's acceptable, you like using it, even now you have good control over it, but not complete. Why not complete? Because even in parties, you will find some people who start with a peg, move to 2, 3, and then at the end of the party, you see that there are some people who are not able to walk properly, they are a little imbalanced. So they have lost some control over the quantity that they should be having. So this is the next stage. What happens after that? They continue taking it gradually. Some problems can be seen. So what kind of problems? Let's say there's a party where alcohol is not available. The person doesn't want to go to that party. So the interest in getting the substance gradually starts increasing and control is gradually diminishing. So the number of parties start increasing. If nobody has invited me to a party, I'll probably arrange a party because I need this. So this is the next stage. There would be occasions where I would probably be driving under the influence when I'm leaving the party. So I cannot stop myself from drinking even though I know that I have to drive back home and it is not good for me. So some element of risky usage also starts in this stage. So what happens if this continues? So when this progresses further, there is a stage where the individual develops tolerance. So what is tolerance? So when people start a substance, they start drinking or any substance, the first time maybe a peg is enough to give you a high. After, let's say, a year of taking alcohol socially, you realize that I need maybe 2 pegs to get the same high. After the 3rd or 4th year, maybe you have shifted to a quarter to get the same high. This is what is tolerance. So your body gets habituated to the substance. You need more of the substance to give you the same effect. This is what is called tolerance, and it gradually increases. So the amount of the substance will increase. The harmful effects will definitely increase in proportion to that. Withdrawal also happens in this stage. So what is withdrawal? So people who have been taking the substance regularly for some period, supposing they have to stop for a few days. Like let's say somebody has been drinking every day and he develops a febrile illness and has to be admitted to the hospital. And he is diagnosed with typhoid, he is admitted in the hospital, obviously he is not getting alcohol there. He starts having withdrawal symptoms. So there would be tremors, there would be sweating, uneasiness, crankiness. Person tries to get out of the hospital, can't stay, unable to bear this distress. So these are the withdrawal symptoms, not able to sleep also. So appearance of tolerance and withdrawal is a very big red flag, because these two are the cardinal symptoms of dependence. So when somebody has developed tolerance and withdrawal, there is a high possibility that the person has developed addiction. And at this stage, there is complete loss of control. The entire day is wasted towards how to get the substance. What will I do so that I can get it in the evening? If I don't have money, how am I going to get the money to get the substance? So the entire life is now rotating around the substance. And how can I fuel the addiction? So these are the stages of substance abuse. Why is it important that we understand these? So that we can stop ourselves from moving to the next stage. What causes substance abuse? Is there any one answer? No. So it's a complex interplay of different kinds of factors. There would be biological factors, there would be psychological factors, socio-cultural factors, and trauma and stress definitely contributes a lot to this. So it's not that, if one of these is present and the other 4 are lacking, there is a strong chance that you won't get into addiction. There might be some problems, but probably addiction won't be developing. But if there are more than one of these factors, there's a high probability that the individual will progress towards developing addiction or dependence. So when we talk about biological factors, genetics is the most important one. So if there is someone in your family who has been addicted to any one of the substances, there is a high possibility that all the blood relatives would be vulnerable to developing any other kind of addiction or the same addiction. So anyone who has a relative with alcohol dependence should be very careful, not only about alcohol but also about other substances, because the genetics are the same for all the substances. Alcohol will definitely be more likely, but even the other substances are likely to become problematic for you. Age of exposure is another point which is very important. Earlier the exposure to the substance, the greater is the likelihood that one will go on to develop dependence. In fact, when we talk about the harm of substances, this again matters, because if the first use has been at a young age, let's say in the teens, 18, 19 is the first time when you had ganja for the first time or alcohol for the first time, the harm it is going to cause you will be more than someone who got introduced to the substance, let's say at 30 years of age. So 18 years of age or 15 years of age versus 30 years of age. Obviously, younger age of onset is more harmful. Gender, see, as of now, men are more likely to develop substance dependence, but like in all things, women are competing with them and they are trying to overcome men. So this number is also growing. I don't know what will happen in a few years, maybe it will be equal. Psychological factors, any kind of mental illness predisposes you to developing substance abuse. Why? Because when people have depression, when people have anxiety, they tries to self-medicate with substance. अच्छा नहीं लग रहा है, 2 पैक पी लो, अच्छा लगेगा. Breakup हो गया, 2 पैक पी लो, अच्छा लगेगा. So that is the solution for everything. So if you have mental illness and you don't know that you can see a professional, you can take some help from a counselor, from a doctor, or you don't have access to them, high possibility that you will turn to substance to solve your problems. Personality, very important factor. So there are some people who are very impulsive in nature, who are prone to taking risks. They like sensation seeking, novelty seeking. Every time they want some new experience to make them feel excited about life. So these personalities are more vulnerable to developing substance abuse, substance dependence later in life. Because it makes them a little unstable, it makes them not able to understand where they are going. So if we understand the personality of people, we will be able to identify that these are the people who are more likely to develop these kind of problems. Socio-cultural factors, cultural beliefs are very important. So like I said earlier, there are states in India where cough syrups are so widely acceptable that they're available in parties as a form of drink. So, and in the same state, I'm talking about Punjab if you don't know, in the same state you'll be frowned upon if you're seen smoking a cigarette, but nobody will frown at you if you're taking a bit of afim. So because there are many villages where you'll find elderly people who have been taking a bit of afim every day for years and years, 40 years, 50 years, and it's widely acceptable. Nobody, calls them nasheri or nobody looks down upon them. So cultural beliefs are going to have a huge impact on whether a substance is going to become common in a place or not. And about cultural beliefs of Sikkim, whether they are contributing to the substance abuse problem in this state or not, you are the people who are going to tell me, because I have no idea. I want to listen from you whether cultural beliefs have a role in the extent of substance abuse we have seen today. Family dynamics. See, if things are not good in the family, there is frequent conflicts between mother and father, and something bad is always happening. Somebody is shouting, somebody is throwing tantrums. People don't feel happy and comfortable at their home. So they find it easy to resort to substance to get some peace. That is what they feel. Thodi shanti milegi. But then it doesn't work, does it? So family dynamics, again, very important. Peer pressure and social norms. So you are in a school, if your senior batch students tell you, yaar bada bhola hai, he is not smart, can't drink with us. Obviously you are very much interested to show them, no, I am also smart. Or you see people, you're looking up to, the popular kids in the school, and you see that they're doing this. You feel like joining that group and you also start doing that. So that is what is peer pressure. So you succumb to peer pressure because you do not know that this is not going to be in your best interests. Easy access, again, very important. So in states where easy access is not there, let's talk about the states where there is prohibition. So prohibition may be there, but it's not that alcohol is not available. So access is not easy. So there is a possibility that children or young adults are not going to find it easy to get the substance, let's say alcohol, and there is a possibility that the age of onset might be delayed. So other point that comes is, let's say there's a school or there's a children's there's a hostel where students are there, and just opposite that school or hostel there is a liquor shop or there is a cigarette shop. So this is not good because it makes access easy. So these are the things that matter when we talk about the causes of substance abuse. Childhood abuse, childhood trauma, it's again a very important factor, because it is not just makes you vulnerable to developing substance abuse, it also makes you vulnerable to developing personality disorders, mental illness. So just imagine all three coming together. So that is how it works. It will increase the risk of developing mental illness, it will increase the risk of developing personality disorders as well as substance abuse, and these two again will lead to a higher probability of substance abuse. High stress levels, let's say people who are working in jobs where constantly they are under pressure to submit projects within deadlines, jobs where they are responsible for big amounts of money, the pressure is so much that they want some relief, and many times they resort to substances for getting themselves done, to finish their tasks, to finish their projects within deadlines. So that leads to a lot of substance abuse. In fact, while talking about this, I don't know if you're aware or not, in many Western countries like US, UK, Canada, there is a very large demand for using amphetamines and medical amphetamines. So they say that they have adult ADHD, so there are questionnaires, and they would all demand the medicine which is an amphetamine based medicine. So whenever people come from US and they meet psychiatrists here and they ask for their prescription to be refilled, that makes us very, it's really strange, because in India you don't get so many people who are adults and who ask you for these medicines. So that is another kind of epidemic. The pressure of getting work done makes you look for substances that are going to make your life easy. So when we have talked about causes of substance abuse, automatically what comes to our mind is how can we prevent substance abuse? So like we discussed earlier, from the causes, we know that family dynamics and parenting, this is one area where if we can bring some positive change, we can get some results. So parents need to have open communication with their children, so that if children have any queries, they can talk about that freely. They can say that, today in the school I saw this, or this kid was telling this, and the parent can then guide the child about what is right and what is wrong. Mental health support. So mental health awareness should be there at the school level itself, so that early diagnosis also is possible. If teachers are aware, they'll be able to spot the child who is having problems. They can tell the parents that there is something wrong and please look for some ways of solving this. Again, education and awareness. What kind of education? Life skills training. What do you do when you are in a situation which is not going as per your wishes? You are facing a difficult time in life. How do you cope with it? So you need coping skills for that. The schools also have to teach you that. How to take the right decisions. Then what are the risks associated with these substances? There are many myths also associated with drugs and alcohol. We can take a few examples now. Supposing I were to say that cigarettes cause cancer, how many of you would agree with me? Please raise your hands. Okay, so many people have raised their hands. Alcohol is bad for your liver. Raise your hands if you think I am telling you correctly. Okay, very good. When it is cold, it's good to take alcohol, it makes you warm. Nice, I can see some hands raised. Good, okay. A bit of alcohol, let's say 2 pegs of alcohol every day is good for the heart. Does anybody believe it? No. Okay. Okay, fine. Cannabis is entirely safe. It's made from a plant, herbal है, natural है. Ganja बहुत अच्छी चीज़ है. Nobody? Okay. Ganja is a harmless recreational drug. कोई नुकसान नहीं है. Nobody? Good, very good. Let me correct you about that matter. See, alcohol is not good for you if you are exposed to cold weather. Many people believe that it makes you feel warm, but that is only the initial effect. Actually, it can lead to hypothermia if you keep on drinking and are exposed to cold weather. So please read up about it. That is a myth. And a few years ago, many people used to believe that alcohol is good for the heart. So you would meet many elderly people who would be taking 2 packs at night, and when you would tell them why are you doing this, they would tell you that there are studies which show that alcohol is good for the heart. So it is true there were a few research papers which came out maybe 20 years ago, but then later on there has been further research that has refuted this finding. So right now, no amount of alcohol is good for you. Absolutely no amount. Right? That part is clear? Thank you. So there might be more such myths. We'll get to know more about them if people start talking about it. So unless we talk to people, we listen to what they believe, we really don't understand that this is what people are believing actually. Peer and community engagement, positive peer groups like sports, arts, it gives you an alternate channel to express yourself. So in the evenings, if there's nothing else to do, then maybe there would be an art club, there would be some sports, there would be book clubs where you can spend your time, you can talk to people and you can maybe get good advice. And similarly, there should be safe community spaces and options for recreation. Policymakers, regulators, they have a role to play. They need to enforce age restrictions, they need to regulate advertising, ambush marketing, community policing, all these are definitely important. Another thing which is very important is easy access to treatment and de-addiction services. So many times in rural areas this is lacking and this causes a problem. But gradually governments are working on it and more centers are coming up. And when we talk about the role of technology, we'll realize that how technology is helping us solve this problem. Trauma-informed care is very important because many people are not able to identify trauma. See, it needs some sort of training to identify that there has been exposure to some sort of trauma. So teachers need to be able to vigilant about it. Primary care physicians, they need to be having an open eye about whether the child is going through something which is traumatic, there is exposure to some kind of abuse or not, because these are the children who will be developing other problems later on. Early warning and monitoring requires that we are able to identify at-risk students at the level of school itself, so that proper guidance can be given and the problem can be prevented. Coming to the management of substance abuse, the first step is diagnosis and assessment. So unless and until we identify that there is a problem, we are not going to be able to solve it. We also need to assess how severe the problem is. And after that comes the phase of detoxification, and then the most important of all, which is relapse prevention. So for diagnosis and assessment, we need to do a clinical assessment initially, which deals with the type and severity of substance abuse. Then we need to find out whether there are any co-occurring medical or physical health issues. Many times there will be a co-occurring mental illness. We call it dual diagnosis. This is very common and this makes treatment very difficult if the second illness is not managed. So dual diagnosis, if there are any physical health issues, for example, the liver is gone, pancreas is half gone, so that gives an incentive. So we might need to do some blood tests also to assess this. So that also acts as a motivating factor. So you want somebody to quit alcohol, you should show them their blood reports. See, your liver is already not functioning well. So if you continue, you're going to further damage your liver and it might become irreversible. So for some people that acts as a motivating factor, and makes them willing to work on themselves to move towards quitting. Motivation and readiness to change, there are questionnaires for this. We do some type of interviewing to find out. This is very important, because if the readiness to change is not there, we cannot force anyone to quit any substance. So there are tools, there are interviews, questionnaires, and we also do lab tests wherever applicable. Then comes the part of detoxification. So somebody who is addicted to a substance, if that person quits it immediately, there might be some medical complications which can even be severe enough to require admission to a hospital and even to the ICU setting. So it always has to be medically supervised, so that if complications arise, they can be adequately taken care of. So this is often the first step when we get someone who is dependent on a substance and wants to quit. This is very, very applicable for alcohol, opioids and sedatives, because the withdrawal is very strong for these substances, and we have to use some medicines to treat this withdrawal. So detoxification, especially for these three substances, should always be medically supervised, otherwise there is a risk to life. Then we come to the most important part of the discussion, which is relapse prevention. So again, like we said, that causes were multifactorial. Relapse prevention also requires an interplay of social environmental changes, medical interventions and psychological interventions. So all three have to be done to get the best results. If we are not doing well in any one of these, we will not be successful in what we are trying to do. For medical interventions, there are medicines which will help us reduce the craving. They make the path to recovery a little easier. And like I said earlier, if there is dual diagnosis, by that I mean there is a comorbid mental illness that has to be treated, otherwise it's not going to be possible for substance abuse only to be treated and to get good results with that. So we might need medicines for that also. I will not go into detail about medicines, it's not relevant for you. Psychological interventions, so for best treatment of substance abuse, there needs to be a good team. So this team will include the psychiatrist, this team will also have good psychologists for this part. So motivational interviewing is a technique which encourages readiness for change. So the conversation is very supportive, it is non-judgmental, and it tries to bring a person from a stage where they are just thinking about changing to a stage where they are willing to act upon that thought. Then cognitive behavior therapy, it's a kind of therapy where we try to change certain dysfunctional thoughts and try to replace them with alternate healthier thoughts. So they can recognize triggers, they can develop coping skills, healthy coping, and they can change their harmful thought patterns. Cognitive behavior therapy will also help if there is some dual diagnosis, like somebody who has anxiety and is using alcohol to manage that anxiety. So it's more likely to benefit with CBT. Relapse prevention counseling is a very specialized counseling. It helps deal with cues. So when people relapse, there are usually cues which are involved. What kind of cues? So there is a person who has been abstinent for, let's say, 2 months, doing well, trying to quit. 2 महीने हो गए, पिया नहीं है. What happens then? Has a big fight with wife today. बहुत झमेला हुआ घर में, and he is angry, is upset. What to do? He knows that the wife doesn't want him to drink. पहले भी झगड़ा होता था दारू के बारे में. So since he has had a fight with the wife and he is angry today and he knows that the wife doesn't like his drinking, today is the day where he is most vulnerable to lapse, because that will be his way of hitting back at his wife and releasing his pent up frustration. So this is a cue. So this counseling involves getting prepared for these cues and making people understand that, see, these are the things that are going to happen and how are you going to deal with these situations when they happen. So cues are very important, and how to manage lapses and prevent relapse. So here the term is lapse and relapse. Why is this different? So when somebody has been trying to quit, a lapse is a single instance of taking the substance. Relapse is when lapses continue to happen and the person returns to the previous pattern of drinking. So our target is not lapse prevention, our target is relapse prevention. And lapses are not actually always bad for you. Because when you are on a journey of quitting, the lapse will tell how you are going to fare in the coming years. So after the lapse, how have you dealt with it? Has your lapse turned into a relapse? This is one of the very important pillars of relapse prevention counseling. How to deal with the lapse so that it does not turn into a relapse. Social and environmental support, see, it cannot be overemphasized. Rehabilitation programs are very important, and when I'm talking about rehabilitation programs, I'm not just talking about the rehab centers that you might have heard about. These can be outpatient programs also. The focus has to be on skill building and preparing the person to get adjusted to a new life, which is free of substance. So vocational training might be needed. Then they need to be reintegrated into family life and into the community. After that, there have to be regular follow-ups so that lapses can be managed. If there is no follow-up, there is a high possibility that a lapse will turn into a relapse. Support groups like Narcotics Anonymous, Alcoholics Anonymous, they are very important. In fact, I have clients who will credit their abstinence completely to these support groups. So for some people, it works very well. They find a community where they are accepted, where they are able to talk freely. There are sponsors in these community. Sponsors, by sponsors I don't mean sponsoring money. They are the people who you can contact any time of the day when you are facing a problem. So that support helps many people to overcome their addictions. So we will now talk about the role of technology. See, we are now in a situation where everything is becoming digital. In the last few years, access to mobile phones, access to internet, access to technology, it has increased a lot and it will continue to increase. So technology will help us in early detection of substance abuse. It will also help us deliver personalized care. Then it also makes services accessible to everyone, even in the remotest corners of the country. And it will help provide long-term support to people. How? Let's discuss that. See, there are digital screening and assessment tools. So you don't have access to a doctor. You might be thinking कि डॉक्टर के पास जाने के पहले मैं खुद देख लूँ कि मेरे पास मुझे प्रॉब्लम है कि नहीं. So most people like to Google everything. And they go, I'm feeling low, then they'll Google it. Then the Google will tell you, you might be having this. So in the same way, there are options of testing whether you actually have a problem or not by using these questionnaires which are commonly available. So there are sites which will give you the questionnaires, but again what needs to be understood is that a questionnaire is not the best form of diagnosis. These are only screening instruments. So with that caveat, there is the option of using these screening tools and assessment tools. So they are accessible 24/7. You can do it whenever you want. Nobody knows that you have accessed it, so there's no stigma attached to it. And biggest thing is that these can be scalable for larger populations. In fact, these questionnaires were designed for population studies only, and gradually they became popular and people started using these. So even in larger populations, like you want to screen the entire school, a questionnaire can be used. There would be 5 questions, there would be 10 questions, and it takes very little time. Then there are apps, mobile apps, which are based on health, and they tell you about what you are feeling. You can monitor that. There are apps which will talk about your relapse prevention. Then they can help you, they can give you some support for your therapy also. So like there are mood diaries or thought journaling. There are craving logs where you will monitor every day in the app. You will note down how much of craving you are feeling. You can track the triggers. Then the apps will teach you about mindfulness exercises. They'll remind you about your next dose of medicine, or when is your next appointment due. And these apps can also connect you to other people, like they can connect you to professionals or other support systems. So apps are gradually becoming popular. My own organization also has a health app. I'm not saying that it is very good when it comes to substance abuse, but because it's a general mental health app. It's not about specifically about substance abuse. But gradually these changes are happening, and maybe in the next few years we'll see some more apps which would be working very well. Abroad there already are such similar apps. Telehealth and online counseling, now everyone is aware about it. You don't have to go to a doctor, you can consult people online. So the benefits are that even if you're staying in a remote area or you find it difficult to travel every time, you can continue with the follow-up, and you can take help from the best of people. You're not restricted by your location. So rural and remote areas can also be serviced by the help of technology through online counseling. And there is some stigma attached to visiting rehab centers, psychiatric clinics. So technology helps us in that also. This is another upcoming area where maybe in the next 5-6 years we'll see a lot of development. That is wearables and biosensors. So you all would be aware that there are smartwatches, Fitbits, which tell you how much have you exercised today, what is your heart rate, are you doing well or not. So there are going to be devices. There have been some trials about these, but as far as I know, none are commercially available as of now. So there would be these devices which you will wear, and they'll tell you that the alcohol level is more than what it should be, so stop drinking now. Then they would be monitoring your heart rate variability, what your stress level is, and there might be an option for alerting your caregiver that he has drunk a lot, he needs some help right now. So this is going to be the future, and I don't think it will take more than 5 years for these things to be commercially available. Online support communities and forums are very important. Reddit is one option where a lot of discussion takes place, and there are many more such forums where you can get 24/7 peer support, and you can share what you're going through, and there would be people who have gone through the same, and they would be having advice to offer, which might be the wrong advice, but there still would be advice. And people feel connected through these chat forums. There is a sense of connectivity. There are other people who are going through what I am going through, so I'm not alone. Virtual reality and augmented reality. This is another upcoming area where we are going to see a lot of development in the next few years. So virtual reality can be used to simulate certain scenarios. Like I was talking about cues earlier. So relapse is always linked to exposure to cues. There would be certain situations where one becomes extremely vulnerable to take the substance, even though the intentions are good and they're trying to quit. Like I gave the example of having a fight with your wife. There would be some more examples, like you're going to a party. So somebody has had a child and has given a party to celebrate the birth, and you go and you tell there that I'm not drinking. And the pressure is that, no, you have to drink, how can the celebration be without drinking? And you find it difficult to say no. So what virtual reality does is that it gives you a practice of that scenario where the situation is simulated, and you can interact with that simulation, and you can try doing it again and again to see how assertively you can say no. And as you say, practice makes a man perfect. So this definitely helps people to cope better with the cues. So gradually this is also going to become very common, and this can also be used to teach other coping skills also. Electronic health records and sharing of that data helps us by ensuring that different people treating the same person are in the loop. So the psychiatrist is also aware of what is going on. The same document, the same set of records are seen by the primary care physician. The same set of documents can be accessed by the counselor also. So this helps everyone to be in the loop when it comes to the abstinence journey of the client. And so people work in synergy, and obviously we get better results after that. Chatbots and AI companions, again gradually developing, still in the nascent stage. So a chatbot can never be a replacement to a counselor, but it can give some initial support. So crisis de-escalation, improving the motivation, the basic things can be taken care of by chatbots. And gradually we will, as I said, in the next few years, these are also going to become very popular. So after we have spoken about technology, one thing that is really important to highlight is that there are a lot of challenges and considerations involved here. Privacy and data security must be prioritized. Confidentiality is a big issue, and that is what causes problems often. We also need digital literacy and access for that, so everyone has to have access to internet, mobile phone, and should be able to operate the app or whatever device they are taking. But at the end, technology is not a substitute, but only a complement to professional care. It cannot take place of the counselor or the psychiatrist and do everything on its own. That is what we need to keep in mind when we are talking about the role of technology. So that's it. Thank you for your patient hearing.
A student of grade 11 from Greendale School, and it is said that awareness is the first step to change. And for those people who have come to realize and are in a state of self-awareness about their problem, moving forward from that point, many people, they do not know what to do. Like, they don't know what to do next. And I would like to ask you, what, in your opinion, is the best measure that person can take to help with their substance abuse?
Whether I say it or not, the first thing that people are going to go and see a professional. I agree with Google on that. But jokes apart, see, there's a lot of information available on the internet for people who want help. So it gives you the address of the nearest counselor. It tells you about online support forums. The moment you put something on internet, a lot of options come up. So even if there is no one you can ask for guidance, there is something on internet that is going to help you. You need to ask the right questions. That is the issue.
Nice university. So my question to you is, how do you handle ethical dilemmas, especially involving involuntary treatment or medical compliance?
See, the legal issues that we need to take care of. But when it comes to compliance, the thing that works always is asking the person what led to the lack of compliance. So if we are willing to listen, if we ask the right questions, a simple question is, why do you take this substance? Why did you not take the medicine? And we wait for them to answer. Something or the other comes up which we can then act on.
Ma'am, my question is, ma'am, when I was sometimes when I return to school, I go to some shops, and last time the same scenario happened with me. We asked for apple juice, they heard cigarettes. Now the thing is there any law, or should there be any law which prevents shopkeepers from selling these substances to young generations? Because it is a matter of fact that the ingenious people will not sell it to them. They told me that only. They said the Nepali people or anybody from Sikkim itself will not sell any substance to the children. So the children do not go there, they will go to some other shops and they will get the substance from there. So is there any law, or should there be any law which should be implemented so that this can be stopped? And is there any way so that we as students can gather a little bit of evidence and report these kind of things happening? And one more question is there, ma'am, do you think I as a student, we as students, let's say somebody my junior is in substance abuse. Now, if I directly report it to the teachers or his parents, he will be in trouble, and which may cause some mental strain on him. So do you think initially, I can help him in any way? Tell him you can do this, don't walk with me for a while, I will help you. And if it does not get better, do you think I can like take it further?
So coming to laws, the implementation might be a problem. So maybe in some areas they're not being implemented properly. And regarding where you can report it, I'll leave the question to my legal colleagues here. I think they'll be able to answer it better than me. So probably someone will throw light on that issue. Regarding your second question, like you said that if you report it to the teacher, it will cause him distress. My point is that if you don't report it, that also is going to cause him distress. Maybe later, but the distress is going to come. So, as they say, of two evils, choose the lesser one. So it's difficult this way, it is difficult that way. But then there's also something, you can do to reduce the distress. Sometimes what helps is, if you ask him, why do you do this? Probably there might be something where you can help that person and try to control it. Or you might find that maybe the teachers are not the right person to inform this, or maybe somebody else needs to be informed. But then that would depend on the situation. So for that, ask the right questions. Okay?
Madam, I am Preeti. I am a trainee judicial officer. Madam, my question to you is like earlier we talked about section 309 of the IPC, where we would punish someone who tries to commit suicide. Now again, that seems like it is not the right thing to do. Madam, we also have harsh laws for dealing with people who are struggling with addiction. If they are caught using certain substances, then they are dealt with very strictly. Even in schools also, if someone is caught using alcohol or smoking a cigarette, they are immediately given suspension, they are given transfer certificate. So madam, my question to you is, do you think that rather than criminalizing substance abuses, is it time that we should treat it like a disease and offer them support and rehabilitation rather than immediately punishing them or throwing them in places where they have fear of authority, and I really don't think so that's a solution.
So you have opened the Pandora's box with that question, and there is no hard and fast yes or no to that question. So there are pros and cons everywhere. So the view would be different for the first example, like you said, of the student. There I definitely agree. Treating it like a crime is bad. Rusticating the child, giving a transfer certificate. It's a punishment which is too harsh. It's not going to solve the problem. Child will go to another school and he will start something else there. So for the child, I definitely agree. A more gentle approach is needed. We need to find out why the child is doing this. If it is the influence of peer group, we need to work on that, how the peer group can be changed. If there is something wrong which is going on at home, we need to find a solution for that. So treating a child like a criminal and punishing the child is definitely no option at all. But when it comes to adults, or when it comes to people who have been, let's say you talk about hardened criminals and I tell you, no, it is a disease, you should not treat them as criminals, and be very gentle to them, be very, generous in all you are doing there, I would be wrong in that also. So a more balanced approach will be needed in that situation, in my opinion. And that is a big debate. There are some pros and cons with this, there are some pros and cons with that approach. So there is no clear answer to that. And that debate has been ongoing for years now, and there's no clear solution even now. Probably some measures can be taken, and people will need to relook at those measures after a few years to see whether the desired result has been achieved or not. Supposing you decide to decriminalize, relook at it after 5 years, look at the statistics and see if it has made a difference or not. If it hasn't, then again you will need to do something to correct it.
Ma'am, this is the member section which was there in your PPT.
Yeah.
Since we have NGO members also as participants, so that will benefit them. Thank you.
Thank you. So when we come to interventions, but the NGOs definitely have an important role, and the rehabilitation part can definitely be contributed to a large extent by NGOs. So rehab centers are not always the best choices. So if the NGOs can work and make outpatient programs where they are providing vocational guidance, they are providing help in reintegrating back to society, that would be the best thing that NGOs can do in helping people live a substance-free life. NGOs can also help in connecting people with professionals, connecting people with support groups like Alcoholics Anonymous and all. So that is how they can contribute to the social and environmental measures that help in solving this problem. NGOs can become activists in certain areas, like the child at the back who told us about certain shops openly selling substances to young children. So NGOs can help with that also, building awareness, doing what needs to be done when they find that such wrongs are going on in the society.
Hello ma'am.
Yeah.
I had a question that as you have mentioned earlier that there are a lot of states that have imposed ban upon the liquors in their states like Bihar, Gujarat, Mysore, Nagaland, Lakshadweep. Ma'am, despite of the ban that the government of that particular state has imposed, there are a lot of illegal tradings going on. And there are a lot of people who have not stopped consuming liquors. They find some or the other way and they consume it. And because of that, there are a lot of arrests made by the police officers. They are brought before the judicial officers, and we are dealing with those cases. Despite having a lot of pending cases in our courts, we are again dealing with those cases of, like, with respect to the bail to be given to the people who have been arrested, ma'am. So, ma'am, what recommendation or what do you think that apart from banning such substance in the liquors in a state which is brought about by the state governments, what should be exactly done, ma'am? Because I don't think so that restraining, banning in a state actually is resolving the issue from the grassroots level.
See, a ban is as good. So when a ban is introduced, prohibition is started, there is a load on the police, there is a load on all the legal services also to enforce that ban. So their energy is diverted elsewhere, and people always find a way. So when you cannot enforce something, you should think 100 times before introducing that. So the states that have done it should probably think about what have they achieved, whether it is working or it is not working. If it is not working, then think of changing it. But then with politics and other things, these decisions become difficult.
My name is Manita from Tadung Senior Secondary School. So I wanted a suggestion from you. So there is a girl from my society. Her age is 8 to 10 years old, and she told me that she is consuming Breezer, and she also suggested me to drink it, and she said it is very tasty and it tastes like Sting. And a few days ago I asked her that is she still consuming it, and she said yes, she is consuming it, and she again suggests me to drink it. And should I stop her?
Does this find out? If it contains alcohol, don't drink it.
Does it contain alcohol?
I don't know, ask your friends.
Yes, it does.
It's in a very small quantity, but it does.
And so I attend my parents and my parents said that.
Do you find it difficult to tell her no? Why?
Because I am not good at answering to people, and when I tell her don't drink it, and she answers me back that why do you drink it?
See, the first thing is that you are telling that I will not drink it. The next point is don't drink it. And you are giving her advice. See, you need to be assertive when you are telling what you are going to do. Giving advice is something where you can refrain from that also. But at least you should be assertive when you are telling about what you are going to do and not do. You got my point? So you may not be able to tell her what to do and not to do, but for you the answer should be clear. Okay?
I'm a PCT teacher in Indian Senior Secondary School, nearby school. So it would be appreciable if you could put a light on the role of teachers, like as a teacher, how practically we can support and how can first we identify the substance abuse cases in an initial phase with any student, and how can we practically support them, without breaching their trust, and when to involve their parents as a teacher when we first find out, when to involve their parents, and what are the practical solutions as a teacher, if you could put a light on this, it will be appreciated.
See, teachers are in contact with them to notice, because you are dealing with the child every day and probably you have been seeing the child for years. So when you see that there is some change in behavior, the child is, let's say physically or mentally, you see that there are some changes, then that should open your eyes to see what is going on. And you become more vigilant, you start observing the kid more than you were watching earlier, and within a few days you will probably see that there is something going on, and you need to talk to the child, maybe alone, not in front of the class, about what is wrong.
Good afternoon, I am Vishwanath Shomadhar, I am the Chief Justice of Sikkim High Court. The teacher who just addressed a query to you has inspired me to ask a question which I think is troubling me. That is the huge dependency on mobile phone, especially gaming and other recreational activities that are provided in the smartphones, which children, adolescents are getting hooked into. And that's, in my view, a kind of abuse also. May not be substance, but yes, definitely a kind of abuse, although that's not in the part of the topic that we have kept for discussion. But this is a situation which I'm sure the teacher there and others who are dealing with the children on a day-to-day basis would be confronting on. The huge dependency on mobile games and smartphones which are being used in a manner which may not be conducive to the mental health of young adults, children and adolescents. Can you share or throw some light on it?
Yes, sir. Thank you. So psychiatrists are now looking at it as another form of addiction. So there are studies going on about it. People are talking about including it as a diagnosis. So with more and more digital developments, this problem is gradually increasing. What can be done about it is, again, first thing that comes is easy access has to be controlled. So parents have to ensure that the number of hours that is spent with the screen is reduced, and that should be controlled at a young age. So these days we see 3-year-old kids, 2-year-old kids who are being fed the TV or mobile for maybe 7-8 hours a day. The kid starts crying, is not taking his food, the mother puts the kid in front of the TV. So it begins from that age, and gradually once a child has become so used to the screen, at 11 years of age or 10 years of age, you cannot enforce that ban. So this needs to begin at a very young age, where parents need to control the amount of exposure to the screen. Where it has already happened, we do give medicines, we do provide psychological support for all that. Options are there, but then again it is definitely difficult, and it's gradually increasing, no doubt about it.
What should be the role of the teachers in these conditions?
So teachers will need to keep a watchful eye, because most schools ban taking mobiles in the classroom. So if the school is not enforcing that rule, teacher will probably see, children below the textbook, there is a mobile and things are going on. So if the teacher is aware of those issues, then again, the first thing that you need to do is to talk to the child and find out the extent of the problem. Sometimes the kid will tell you that he was just looking up on the internet what you were teaching because he couldn't understand what you were teaching. But if that keeps happening again and again, and all the teachers have noticed it, then probably it has gone to the extent of a problem and something needs to be done about it.
Thank you.
class 11 science. And my question is that a few days ago, my friend told me that she saw someone selling illegal substances in like her area. And like
selling what? I couldn't hear you.
She saw somebody from her village selling like drugs and all, and like she couldn't inform the police or someone since she went to her parents, and her parents told her that it might be something else, and they don't take her seriously. And she couldn't go to the police since her like village is kind of small, and they could easily recognize her, so she's kind of scared. So is there any way we can report these things anonymously, or if there is not, is there any other possibilities we can go to?
The first responsibility is to yourself. Whether we can do something to involve the police, to involve the authorities. See, I'll be pragmatic here. It may not be easy for everyone because you would have to convince your parents. You cannot go to the police station on your own. So parents might have the idea of telling you, no, don't get into it. These people are dangerous. So you'll have to listen to your parents also. But what is in your hands is what you do with your life. If there are no buyers for the substance, how will somebody sell it? Okay.
In many schools, the student eats many bad things like drugs and alcohol, and teachers suspend them for 20-30 days. If they do like this, they will agitate. More. So what we can do for this?
मुझे ना ठीक से समझ नहीं आया. To find out why the child did it. See, if you suspend the child and he spends the 20 days taking alcohol, what is the benefit? We have actually increased the problem. So the teachers have to become a little bit more mindful about that and think about why the child did this.
I'm Anirudh Kumar Dewan and I'm studying in Greenhill School and I'm from class 2 commerce. So many substances are easily accessible, particularly alcohol. There are like 4 to 5 alcohol shops just in the area I live, and they're like open most of the time. And it's not just alcohol. Other substances like cigarettes, tobacco are like available in almost every shop. So people are able to purchase and buy these products whenever they want. And I believe that it's because of this easy access that these substances are being abused commonly. So my question is, why are these substances, even if they are so addictive and harmful, so easily accessible? Why is there no restriction on the sale and purchase of these products, especially among the adults?
The reason they are easily available is because the government gets stopped, like the states who have enforced prohibition are losing out on that revenue. So legal does not mean harmless. That is the message that needs to go. So it is for the governments to decide. I totally agree with you, but then at the same time I would also like to tell you that stopping the sale is not going to make the problem go away. Because people who want to drink will find some way of getting that substance. They'll go to the next state, they'll cross the border, get it, and then sell it at 3 times higher price. Okay? So the right way has to be through making people aware that it is available, but don't go and consume it.
Forward is people these days, like the young generation, in order to escape reality, they have been using substance abuse, whether through peer pressure or family problems or even trying to avoid life problems. And what you suggested us was to talk to someone professional, but let's be clear that statistically speaking, in this economy, not everyone is financially stable, and then they do not have the money to just go every sessions, pay for it, and then talk about how it has been affecting them mentally. So what are like other things that we can apply rather than spending money, but it will still be helpful?
See, there are helplines which are available free. So you can connect with any helpline and talk to a counselor, going to cost money. Then there are government hospitals where professional services are also available for free. So there are a lot of options. Even if you don't want to spend money, there is a lot that can be done to seek help.
One more question. But not everyone will have the courage, the confidence to just go to the teacher and talk about their problems, or rather just go to website, search for it and talk to a random stranger, because it's really hard for people to open up right forward and to a stranger, and it wouldn't really, I would personally not do anything like that of sort, even though if I'm going through something. So what about that?
In my experience, people find it easier to open up to a random stranger than talk to someone you know. Because you feel that the stranger is not going to judge you. You're not going to meet the stranger in the evening or tomorrow. So people do find it easier to talk to strangers. Supposing you don't, then if teachers are not that supportive that you can approach them, there would be other people, maybe some uncles or aunts or your parents or siblings who you can talk to. So you'll need to find someone. If you can't search the internet also, क्या करोगे? कुछ तो करना पड़ेगा ना. किसी को तो पूछोगे. So there has to be someone. And accessing the internet does not require courage.